Hello, Assalamu alaikum everyone. My name is Dr. Haris Naseer, and I hope all of you are fine and well. So, let me just give a brief introduction about me. I graduated from LUMS Jamshoro in the year 2013, and I did my fellowship training from this same institute. Also, I cleared my overseas registration exam during my training period, and currently I'm working as an associate dentist in Edinburgh. Now, today I would be discussing about the exam, the overseas registration exam, which is the UK dental license. And this basically, by clearing this exam, it allows you to work in the UK. So, this is basically an exam which tests your clinical and basic knowledge and your hands-on skills. So, to start with, if you want to give this exam, first of all, you need to get yourself registered with the GDC. And in order to do that, you need to fill an online application form. You need to have a valid IELTS with minimum score of 7.0. You need to have a UK NARIC certificate. You need to have a PMDC good standing certificate, and you need a character and a clinical reference. Now, once you have all these documents along with the application form, you need to send them over to the GDC as a part of hard copy, and normally they will take approximately 2 months to process your application. And once it's been processed and successful, they would give you a login ID and password for a GDC account. Once you have the GDC account in place, you can actually go ahead and book the exams. So coming to the exam, this exam comprises of two parts, part 1 and part 2. Now the part 1 held in London, and it involves two papers, paper A and paper B. The paper A and paper B both contains 200 MCQs and EMQ questions, and each of them lasts for 3 hours duration, and they are held in London. Now, they are held twice per year. One is in April and one is in August. Now, once you clear this exam, you automatically get yourself enrolled into the Part 2 candidate list, and then along with that, you can actually go ahead and book the ORE Part 2. Now, ORE Part 2 is basically a thorough, extensive exam comprising of 4 components. Number 1 is the OSCE, number 2 is the dental mannequin, number 3 is the diagnosis and treatment planning exercise, and number 4 is the medical emergencies. Now, I will be discussing briefly each and every component. So number 1, and the OSCEs. The OSCEs involve actor, written, and skill OSCEs. In the actor OSCEs, there would be an actor who are actually very trained. They come from the London Drama School, and they would be presenting a complaint to you, and you need to actually counsel them, show an appropriate sympathy and empathy, and you need to discuss the problem, and you need to devise the treatment plan, and you need to tell the patient the treatment plan, and you need to obtain a valid consent from them. So, and you will be marked accordingly in each scenario. So, and the other component of the OSCEs would be an actor OSCE, a written OSCE. In the written OSCE, they can give you an exercise such as an X-ray where you need to write the radiographic findings, or they can give you some clinical based questions which you need to actually fill up, such as a prescription, such as a referral letter. And and the third component of the OSCEs is the skill OSCEs, in which they can give you a simple exercise such as suturing or rubber dam application, or surveying a cast, for example, X-ray positioning. So these are a couple of the skill OSCE stations. Now, the first part of the exam, the actor OSCEs, the first part of this OSCE examination, it comprises of approximately 18 OSCEs, and it's of 2 hours duration, and it is on the day 1 of the exam. Now, in the day 2, the next day, the second component, the dental mannequin, takes place. In the dental mannequin, they would judge your clinical skills and your safety of work, your position and your techniques, especially your indirect vision, and um, they would give you three exercises which can include some basic cavity preparation from class 1 to class 6 cavity preps, some composite build-ups, the crown preparation exercises, which include the PFM crown, a gold crown, a veneer fabrication, and a couple of temporary crown fabrications, rest seat preparation, etc. And there's a list of couple of other exercises that you need to actually do and do at a clinically appropriate level. And there would be two examiners that would judge your exercises, and it would be approximately of a 3-hour duration exercise for the dental mannequin. Now, once you go along with the dental mannequin, the day 3 would be a DTP, a diagnosis and treatment planning component, and the medical emergency component, the fourth component. In the diagnosis and treatment planning, there would be a patient, and he would come up with a complaint. You need to take an appropriate history. In the history sheets provided, you need to make your provisional diagnosis. Then you will be provided with some x-rays and other radiographic artifacts. You need to read those artifacts and compare the history and make up a treatment plan for the patient. And after half an hour, the patient will come back, and you need to actually present your treatment plan and your findings in a way the patient understands, in the way it's free from jargons. And after that, you need to obtain a valid consent from the patient. And this is the treatment planning exercise. It lasts for approximately 1 hour duration. And once you're done on the day 3 of the dental DTP exercise, in the later part of the day, you would be called in for the medical emergency exam. Now, in the medical emergency exam, they would be giving you a clinical scenario, 3 clinical scenarios to be exact, with the normal everyday medical emergencies that can occur in the dental practice, such as anaphylaxis, such as choking, such as hypoglycemia. And they will ask the signs and symptoms and the appropriate management options if that happens. And also there would be a mandatory BLS examination, a BLS exam. You need to perform a basic life support in front of the examiner, and you need to pass the medical emergency component. Now, once you're done with all these 4 components of the exam, it takes approximately a month for the results to come out. And if you're lucky enough and if you pass the exam, you would be allowed to submit your documents to get registered with the GDC. And once you get registered with the GDC, you need to search for the basic job, for the jobs across. You need to do a 1 year of vocational training, which I completed recently. And after completing your vocational training, you would be registered as an associate dentist. So meanwhile, in your VTE period, you can actually earn better. I would say approximately a normal VTE associate could earn up to 40 to 60,000 pounds per annum, which is approximately 3,500 to 4,000 pounds per month, which is good to start with. But provided that this do steeply increases with time, along with your experience and along with how much you actually groom yourself and how much you go for the further courses and further training across. So 45 to 60,000 is actually just the start. Coming to the financials for this exam is not cheap. It is an expensive exam. The part 1 of the ORE costs approximately 800 pounds. The part 2 costs 2,900 pounds. For the component, for the courses, you need to take a couple of courses for the ORE part 2, which can cost approximately 3,000 pounds. And also you need to purchase your dental mannequin, the artificial Frasaco teeth, and the burrs, and you need to actually practice, which can these equipments and the materials can actually cost up to 2 to 3,000 pounds. And also you need to make your travel expenses. You need to make sure you have your a valid visa, and so these in total approximately, when I calculated, they were approximately 12,000 pounds worth of an expense that you need to make, um, provided that if you clear the exam in the first go. So this is the basic amount, bare minimum amount that you need to have in place. Now, once you clear this exam, is it worth it? There are many candidates who do ask me, is it really worth it to go to the UK and practice in the UK? Well, I say it more depends upon your choice. How do you want your life to be in the near future, and what do you want and what do you aim in life? And I would say after this long struggle, I'm very happy to come here in UK, and you can go for further training. Then there is a huge scope of improvement, and I would say it's absolutely worth it. Now, this is a basic introduction about the ORE exams. Now, I'm sure you guys must be having like multiple questions in your mind, and whatever questions you have, I'm really happy. I would be happy to answer, and you're free to just approach me, and I would answer your questions. Thank you.